If you've tried every stretch or mobility technique under the sun and have had no relief from your knee pain, then this video is for you. With any knee rehabilitation program, building up the resilience of the tissues around the knee and building that load capacity is a crucial component of any sort of plan. Now, although rest will definitely help your symptoms short term, it's not going to get you performing back at your best long term and with success. Today, I'm going to go through 4 crucial components, in our opinion, should be included in any sort of knee rehabilitation program. Now, the first exercise component are glute bridges. Now, this could be with resistance or just free weights, as some of these examples show. Now, an important thing to remember when we're doing our glute bridges is to push through the middle of our foot. So the same amount of weight through your toes as your heel. A lot of the time, we can be told to push through our heels, and that facilitates a lot of quad and low back and not a lot of calf and hamstring. Now, why do we want that calf and hamstring to work? With any sort of knee pain, those 2 muscles, they're the brakes in your car. And without brakes, we run into some troubles. So with any sort of glute bridge, start to think about, with your intent, pushing through your midfoot. Now, the second component are looking at exercises that are actually stressing the knee into high levels of flexion or bending. Now, as I speak about the why, here are a few of those exercises. Now, the reason why we want to do this is it improves the capacity of those knee structures to work really hard and high levels of flexion. So now that knee is used to loads and stresses in a big range of motion. So when you throw your everyday life or your training or gym performance, it's only stressing in this range and the knee isn't going to give you as much grief. Now, our third component is all about control at the hip, as shown in these examples. Now, with any sort of lower limb rehabilitation, you don't just want to zone in where it hurts. A lot of the time, and what we've found with our knee patients, there's some issues around the outside of the hip, some weaknesses around there, which are causing the knee structures to cop a whole lot more load. So when we're not strong through the outside of our hip, our knee can drop in. Now, this is not a bad movement necessarily, but repetitive stress can definitely lead to knee issues. So give these exercises a try. And the last component is all about the baby cows, the calves. A often very forgotten about muscle to work when it comes to knee pain. Now, our calves, as we land, when we're running, jumping, hopping, doing anything, absorb a lot of the forces shooting up our leg to our knee. So even you might run a lot and you think you've got strong calves, incorporating some of these calf exercises can really help reduce your symptoms and improve your performance moving forward. So there you have it, 4 crucial components to any sort of knee rehabilitation. Now, if you're looking for a tailored solution to your unique knee pain, please comment knee pain below and we'll reach out to you and start the conversation on how we can actually get you back to your best and actually keep you there too.